Welcome, everyone. I'm glad you're here today. We're about to dive into an interesting topic, slapped cheek disease. This is the first slide of our presentation, and I'll be guiding you through what you need to know. We'll cover the basics of the disease, its symptoms, how it spreads, and what to do if you suspect someone has it. So let's get started and explore this condition together. Let's look at this case of the red-cheeked boy. Imagine a 7-year-old boy who comes in with bright red, warm cheeks that look almost like a slap mark. He had a mild fever and a runny nose just a few days ago, but now he seems to feel fine, except for the rash on his face. This pattern of symptoms is important because it helps us narrow down potential causes. The redness and warmth of the cheeks, combined with his recent mild illness, are clues that may point toward a viral infection or a specific dermatological reaction. Understanding these key features allows us to connect this case to broader concepts about how viral illnesses can manifest with characteristic rashes and facial redness. So, as we proceed, keep these signs in mind. They're vital for accurate diagnosis and effective management. Let's take a look at case 2, which I like to call the worried teacher. Imagine a pregnant primary school teacher who has recently been in close contact with a child diagnosed with slapped cheek disease, also known as fifth disease. She's currently in her first trimester, and naturally, she's feeling quite anxious about what this exposure could mean for her unborn baby. This scenario highlights some important concerns about infectious diseases and pregnancy. It's crucial to understand that while some infections can affect the developing fetus, the level of risk varies depending on the disease and the stage of pregnancy. In this case, her worry is completely understandable, and it underscores the importance of knowing how to manage such exposures effectively. Throughout this presentation, we'll explore how to assess and respond to similar situations, emphasizing the need for prompt action to protect both the mother and the baby. Let's look at case 3, which involves the sudden pallor in a young patient. This is a 10-year-old boy who has sickle cell disease, a condition we're all familiar with. Suddenly, he develops pallor and feels more fatigued than usual. These symptoms suggest that something acute is happening with his blood counts. When we look at his lab results, we see severe anemia, indicating a significant drop in his red blood cells. Interestingly, his reticulocyte count is very low. Reticulocytes are young red blood cells, so a low count suggests his bone marrow isn't producing enough new cells to replace what's lost. It's also important to note that he has no history of bleeding, so this anemia isn't due to blood loss. Instead, it points towards a problem with red blood cell production. In the context of sickle cell disease, this scenario could be a sign of an aplastic crisis, which is often triggered by infections like Parvovirus B19. Recognizing these key features, the sudden anemia, low reticulocyte count, and lack of bleeding, is crucial for timely diagnosis and management. This case highlights how important it is to understand the underlying mechanisms causing anemia, especially in patients with chronic hematologic conditions like sickle cell disease. Now, let's take a closer look at the culprit behind this condition, Parvovirus B19. This tiny virus is non-enveloped, meaning it lacks a lipid membrane, which actually makes it more resistant to environmental factors. It's a single-stranded DNA virus, which is quite important because it influences how the virus replicates and how our immune system responds to it. Transmission of Parvovirus B19 mainly occurs through respiratory droplets, so when someone coughs or sneezes, the virus can spread through the air. It can also be transmitted via blood transfusions or from mother to fetus during pregnancy, which is particularly concerning for fetal health. Once inside the body, this virus specifically targets erythroid precursor cells in the bone marrow. These are the cells that develop into red blood cells. By infecting and destroying these precursors, Parvovirus B19 causes a temporary halt in red blood cell production. This interruption is especially problematic for individuals with already compromised red blood cell turnover, such as those with hemolytic anemias. The result can be a sudden drop in red blood cell count, leading to anemia. So, understanding how this virus operates and spreads helps us grasp why it can cause such significant hematologic issues. It's a key part of the overall picture we're exploring today about viral impacts on blood health. Let's take a closer look at the clinical spectrum of this condition. In children, the initial signs are often mild, flu-like symptoms, which can be quite subtle. However, what sets them apart is the characteristic, slapped cheek rash that appears on the face, giving it a distinctive appearance. Later on, some children may develop a lacy reticular rash that spreads on the trunk and limbs, which is a helpful diagnostic clue. In adults, the presentation tends to be different. Many adults, especially women, experience joint-related symptoms like arthralgia or even arthritis. These symptoms can sometimes be quite painful and persistent, making diagnosis a bit more challenging if you're not aware of this pattern. Now, for patients with hemolytic disorders, the infection can cause a transient aplastic crisis. This happens because the virus temporarily suppresses bone marrow activity, leading to a sudden drop in red blood cell production, which can be severe in those with pre-existing blood disorders. Lastly, pregnant women are at particular risk. The infection can lead to fetal complications such as fetal anemia and hydrops fetalis, which can have serious implications for the pregnancy. This highlights the importance of screening and monitoring in pregnant women to prevent adverse outcomes. Overall, recognizing these varied clinical presentations helps us better understand the full spectrum of this disease, emphasizing the importance of tailored diagnosis and management across different patient groups. Now, let's discuss how we diagnose and manage Parvovirus B19 infections. For diagnosis, the key is detecting specific immune responses or the virus itself. We look for IgM antibodies, which indicate a recent infection, or perform PCR testing to identify viral DNA directly. When it comes to treatment, the main approach is supportive care, meaning we focus on alleviating symptoms and maintaining comfort. In cases of severe anemia, blood transfusions might be necessary to replace lost red blood cells. It's important to note that currently, there is no vaccine available to prevent Parvovirus B19 infection. Understanding these points helps us manage patients effectively and highlights the importance of early detection and supportive treatment in clinical practice. Let's break down the mnemonic, B19 equals baby, blood, blush, to remember some key clinical features of this virus. First, baby. Infection in utero can actually lead to hydrops fetalis, which is a serious condition involving abnormal fluid accumulation in the fetus. It highlights the importance of maternal infection during pregnancy. Next, blood. This virus can cause an aplastic crisis in patients who already have underlying hemolytic anemia, like sickle cell disease. It essentially suppresses red blood cell production, leading to a sudden drop in hemoglobin levels. Finally, blush refers to the classic slapped cheek rash we see in children. It's a very distinctive bright red rash on their cheeks that often appears suddenly. So, by remembering these 3 points, baby, blood, and blush, you can quickly recall the major clinical features associated with this infection, which ties into the overall theme of understanding how it affects different populations and systems. Now, let's talk about the exam and clinical relevance of this topic. It's actually a common subject that comes up quite often in pediatrics and infectious disease exams, so it's really important to understand. One key point is that it's a crucial differential diagnosis to keep in mind, especially when evaluating patients with sickle cell disease or thalassemia who experience an aplastic crisis. Recognizing this can significantly impact patient management and outcomes. Additionally, it's vital to remember that this condition has important pregnancy-related implications, such as hydrops fetalis. That means that in pregnant women, if not diagnosed and managed properly, it can lead to serious fetal complications. Overall, understanding these points helps us better identify, manage, and counsel patients and their families. It ties into the broader theme of recognizing infectious and hematological conditions that have significant implications across different patient populations.